Good afternoon. Thank you all for being here. My name is Hannah Woodburn. I'm the Deputy Secretariat Director for the Global Public-Private Partnership for Handwashing, also known as the PPPHW. The PPPHW is a coalition of international stakeholders whose focus is handwashing and child health. Our work is comprised of advocacy and knowledge leadership efforts. We have 10 steering committee members who comprise our secretariat. They are Colgate-Palmolive, FHI 360, the London School of Hygiene and Tropical Medicine, Procter & Gamble, the University at Buffalo, the Water and Sanitation Program at the World Bank, and the Water Supply and Sanitation Collaborative Council, WSSCC, UNICEF, Unilever, and USAID. Thank you all very much for taking the time to join us today to discuss what's new in handwashing and hygiene programming, technology, behavior change, and more. We have a very exciting hour in store for you. I am going to give you a brief rundown of, first, why we are here, and second, what you can expect from this event. As you may know, the two greatest causes of childhood death are diarrhea and pneumonia, which together account for approximately 1.7 million deaths of children under the age of 5 each year. For many more children, these diseases result in missed opportunity through missing school days, contributing to poor nutrition, and more. Simple hand washing with soap at critical times can significantly reduce these illnesses and prevent these deaths. Furthermore, hand washing with soap can pave the way for educational attainment, greater equity, and ultimately stronger economies in the countries where it matters most. And, of course, as the world grapples with the current deadly Ebola outbreak, the role of hand washing in preventing the spread of infection is particularly salient. Given the importance of hygiene, each year on October 15th, hundreds of millions of individuals gather around the world to celebrate Global Handwashing Day, a global advocacy day that raises awareness about hand washing with soap. As our Global Handwashing Day celebration here in Washington, D.C., we want to take the opportunity to look at hand washing and hygiene through three lenses: that of integration, innovation, and behavior change. To do that, we will have 8 diverse 5-minute presentations that pertain to these topics. They will be followed by a networking reception at 6 o'clock, so I hope you'll stay around to join us for that. On your tables, you will find an order of a program, as well as space to jot down takeaways, notes, and questions. Speaking of questions, we will not have a formal question and answer period during the event, but many of the speakers will be staying around afterwards, so be sure to catch them to ask any questions you have at that time. Also, we encourage you to tweet. You can use the official Global Handwashing Day hashtag, which is #IWashMyHands. And then also, just so you know, in line with the international nature of Global Handwashing Day, we are live streaming the event, and then we also will have a recording available on our website afterwards. Before we get started, I do want to take a quick opportunity to thank our event co-sponsors. First, Devex. Devex is the largest online platform for the international development community, providing business information, recruitment services, and news to over 500,000 global development professionals and 1,000 development organizations. They regularly cover issues around WASH, and if you aren't a member, I would encourage you to sign up for a free profile so you can start receiving their news coverage. They also have a table, so be sure to stop by and pick up the materials that they have. Second, our good friends at WASH Advocates. WASH Advocates is a nonprofit, nonpartisan initiative dedicated to help solving the global safe drinking water, sanitation, and hygiene challenge. Their mission is to increase awareness about these issues and to increase the amount and effectiveness of resources devoted to these solutions throughout the developing world. And last but not least, FHI 360, where we are gathered. FHI 360 houses the Secretariat of the PPPHW. They are a nonprofit human development organization dedicated to improving lives in lasting ways by advancing integrated, locally driven solutions. And to welcome you all today, I'm going to hand it over to Tim Mastro, who is the Group Director for Global Health, Population, and Nutrition here at FHI 360.
Well, thanks very much, Hannah. That was a great introduction. Yeah, I'm Tim Mastro. I head up Global Health, Population, Nutrition here at FHI 360. I have the privilege every day of coming to work and working with this fantastic group of people that works on hand washing and WASH and our other portfolio of health activities. And we're really delighted to serve as a secretariat for the Global Public Partnership for Hand Washing and link that with our work with our USAID-funded WASH Plus program. Many of us are going to be in Chapel Hill, North Carolina next week. Actually, that's where I live. You know, the FHI 360 headquarters is in Durham, North Carolina. This is our Washington office. But at the UNC Water and Health Conference, we'll be doing issues related to hand washing, and we're delighted to be a sponsor of that event as well. Yeah, I'm a physician by training and have been a medical epidemiologist for many years before I joined FHI 360, and I started my career working in refugee camps on the Thai-Cambodian border, which gave me my first sort of professional international experience with hygiene-related issues and water shortages and things, and my personal acquisition of hepatitis A virus during that experience gave me a very real feel of the importance of hand washing and transmission of diseases, and I was very intrigued by the Find the Feces statement over there, and it brings a lot of things to mind, not the least of which, we have a lot of CDC colleagues that are currently working in Sierra Leone and Liberia, and I think the global epidemic now, or the West African epidemic of Ebola, just reminds us, and I think it will likely heighten attention to hygiene in particular, need for water and hand washing, and certainly Ebola is not a waterborne disease, but I think the whole attention to the woefully inadequate levels of hygiene in the world will be heightened by this, and hopefully in a good way to enhance all of this. We think about hand washing in the context of WASH, and at FHI 360 we're particularly interested in integrated delivery and integrated development activities, and see water sanitation and hygiene as being a really wonderful cross-cutting activity that should permeate almost any kind of development activity. We currently have a grant from the Bill and Melinda Gates Foundation to explore with them how best to do integrated delivery of programs, and would hope to have WASH be high in that agenda, working with them over the next couple of years. So anyway, I'll be very brief. I just want to invite you in the audience, as you're watching these presentations over the next hour or so, think about how think about your specific role and how that might be integrated and innovate and to increase the number of people hand washing with your hand washing with soap in your programs around the world. But anyway, thanks for being here today. Should be a terrific event, and thank you all for joining us. Thanks a lot.
Y'all are going to see a lot of me today. Thank you, Tim, for that welcome. Continuing on Tim's remarks on integration, we're going to explore ways in which hand washing is being integrated into other programs. To kick it off, we're going to turn to Anna Gerard, who leads Sightsavers' private sector engagement program. Sightsavers International is an international organization working with partners in developing countries to eliminate avoidable blindness, and Anna will describe their pilot integrating face washing and hand washing in a school pilot program. She joins us on Skype from her home in the UK.
Great. Thanks so much. Hi, everybody. So I was this evening about the Super School of Five, and that's the integration of face washing into the Lifebuoy existing School of Five hand washing program that is being kind of implemented all over the world. Next slide, please. Thank you. Now, why are we doing this? Well, Sightsavers and many other NGOs, supported by the Queen Elizabeth Diamond Jubilee Trust and UK Aid, are trying to eliminate trachoma in many countries across Africa. And trachoma is a blinding eye disease, which has a very simple solution. Kenya, as you can see on the map, is one of the first countries we're implementing this program in, because it has the highest number of people at risk of trachoma living in endemic communities, and that's 16 million people out of the total 229 across the world. Now, we're all following WHO-endorsed SAFE strategy. That's S-A-F-E. That stands for S is surgery and A is antibiotics, and that's something ourselves and the other eye care partners do very well indeed. Last year we supported over 100 million treatments alone, and that number is rising rapidly. But the other part of SAFE, which is F and E, which stands for facial cleanliness and environmental change, is something that we don't do every day. That's not our bread and butter. And we know it's something which is going to be challenging, it's going to be quite expensive. You see from the slide that I put a picture of a child with flies on, and that's really because children are the key transmission agent really in these communities, because they have dirty faces, and the flies then are attracted to their faces, and the flies then go off and take the bacteria with it and transmit to other people. And children are in close contact with each other and in very close contact with their caregivers. So there's a high chance of transmission that way. We really wanted to look at a way that we could work with the WASH community and integrate face washing into existing hand washing programs. And I'll just talk you through some of the things from Turkana. Next slide. Thank you. Now, this was a study undertaken by LSHTM not so long ago, which highlighted a few key points for Turkana, which is a very northern part of Kenya. West is very dry, arid, desert-like conditions. We know very simple things. We know face washing is a routine. We know there is water, very limited supply, but it should be stored in homes overnight. But we know that the prioritization of water for hygiene is probably not there. And that was one key area we wanted to look at, was really how we can get the kind of child to learn those behaviors around hygiene, but also to take that back into their homes to act as the change agent. Next slide, please. So we recently teamed up with Lifebuoy team in Kenya, and as you see from this, the left side is their existing hand washing program, which you probably all know very well. It's the 21-day activation School of Five program, and really look at how best to integrate face washing within that. The last 3 weeks we've been running a pilot in Turkana in 10 primary schools. And we've been running some research alongside that. But unfortunately, the pilot only finished last Friday, indeed. So I don't actually have any kind of concrete, hard facts to tell you about the behaviour change. But certainly, I was in Turkana myself last week, so I can tell you a few key points from the observations that I took. Next slide, please. So. As I said, water was going to be a problem, and it is definitely a problem. It's a very, very dry area indeed. Sanitation in schools is also has been quite challenging. But one of the key points we were really looking at with this program is one of the triggers for the behavior change is the meal times, so the breakfast, lunch, and dinner times. And we know that schools, primary schools in this area do receive lunch at school, so that's fine, and they're very likely to have a very small supper in the evening. But what we can see from, and probably will come out of the research, is that breakfast doesn't exist, and we want to look very closely at kind of the trigger of that and what that means for behaviour change in terms of when the children are actually going to wash their faces in the morning. Combine that with the fact that the primary schools are more likely to have access to water than the homes are. So we really want to look at the best way to mobilize, yes, the availability of water, but also then the key behavior change trigger points within the program. And the final slide, please. So I just leave you with the last picture from the children in Turkana. The findings from the research will be available within the next month, and I'm happy to share that with whoever emails me. But this is a picture of actually the children in a school I visited acting out the pledge. That is one key component of the program. And this particular school was able to recite it in 3 languages, English, Swahili, and Turkana. And this is them actually air drying their hands. That's it. Thank you very much for having me this evening, and I wish you a good rest of the program. Thank you.
Excellent. So As I mentioned previously, lack of access to hygiene is an equity and a gender issue. The WSSCC, which is a partner organization of the PPPHW, is a global membership and partnership organization working with millions of households in Africa and Asia to improve sanitation and hygiene. We are very lucky to have Chris Williams with us today. He's a permanent member of the United Nations, serving as the executive director of the WSSCC, and he will speak on the work that WSSC is undertaking to integrate hand washing, menstrual hygiene management, and gender.
Thanks. I think what Hannah is trying to do is get us to talk faster so that we utilize the full 5 minutes. So we have to. I will try to speak as fast as Hannah does, but I'm not going to succeed. I'm impressed, Hannah. You pack a lot in a short period of time. I just want to focus on 3 things in the limited time that we have. The first concerns scale. Second thing is sustainability, and the third is innovative approaches to gender through menstrual hygiene. Concerning scale, the Water Supply and Sanitation Collaborative Council initiated in 2007 a global sanitation fund, which is currently capitalized at about $250 million. It provides contributions between $5 and $10 million to national sanitation hygiene programs in 15 countries so far. We're aiming to get 25, mostly in Africa and Asia. In these countries, there's a major focus on hygiene, hand washing, behavior change interventions that's layered on top of a community-led total sanitation or triggering interventions at the household level in each of these countries. So we target roughly 250 to 300,000 households per country, engaging either with government or directly with international organizations and local NGOs to try to begin with scale. Rather than to work in a few communities and try to scale it up, we have entire regions of the country over 5 years that we try to have complete freedom of open defecation practices, improved sanitation, and hand washing at critical times. On each of these subjects, I could have much longer discussions, but I'm trying to keep to my 5 minutes. The second piece that I wanted to focus on is the issue of sustainability. We've decided that we have been a bit fast and furious, as has many institutions in the sector, about the way in which we document and track sustained behavior change. So we've questioned our own work, and we've entered into a partnership with the London School of Hygiene and Tropical Medicine to zero in on our work in Nigeria and a few states, and to literally spend hundreds of hours through teams of researchers to live with families, to begin to understand the consistency of behavior change interventions. What is it that are the routines? Some of what Anne was just talking about in Turkana. How do we look at a series of cultural, social, political, economic practices that cater to sustained behavior change? It's one thing for a community to be open defecation free and to have hand washing as a regular practice in improved sanitation sites throughout the villages and peri-urban areas. It's another for that to be the case 2, 3, 4, 5 years down the line. So how do we get deeper into analyzing actually what's happening? What are the things that are sustaining forms of hygiene and better behavior? The third piece that I'm focusing on is menstrual hygiene. I think this is something that has really taken the sector by storm. We're very pleased to be working with a number of organizations in this room, as well as those not here in the sector, to look at menstrual hygiene from 3 perspectives. The first is to open up discussion and debate, to break the taboo, to have it as an open discussion in each of the areas in which we're working in with our Global Sanitation Fund, as well as with policymakers at central government level, as well as independent schools and health clinics. To basically open up the discussion, to put it on the table, to have it as part of the discussion in any effort of public health intervention or focusing on sanitation and hygiene, have it part of the discussion. The second is to look at safety issues and security for women, not only in schools but in households and clinics. What is the quality of sanitation and hygiene facilities? Do young women, particularly adolescents, feel comfortable and safe managing hygiene issues of menstruation in those facilities? In India, we're finding that the association of bathing areas together with sanitation facilities is a huge jump for women. quality of hygiene and the ability for women to manage menstruation is much higher if the design of toilets is aligned with those of bathing areas. It's a major, I think, breakthrough we're seeing in India, and it possibly has implications outside of India. And the last piece is safe disposal of menstrual pads, so that we are looking at the whole waste disposal issue in a more constructive way. Again, referencing India, a lot of municipalities, particularly the smaller ones, are finding that menstrual pad poor waste removal of menstrual pads is actually clogging entire sanitation facilities in major metropolitan areas, to the point where it's a municipal sustainability issue as much as it is a women's empowerment issue. So looking at menstrual hygiene, we are working closely with a number of groups, intensively with Accenture development partners to look at designing a menstrual hygiene hub that would be a go-to place for innovation and knowledge that could facilitate platforms for discussion on this issue, so others in the sector can both contribute and learn from it. So with those initial comments, I hope I've kept the faith, Hannah. Thanks very much.
So far, we have looked at integrating hand washing with other parts of the wash sector. However, given the broad health benefits that come from hand washing with soap, it can also be integrated in many other development areas. We are now going to look at the integration of hand washing in an infant and young child feeding program in Bangladesh. Tina Sangvi from the Alive and Thrive project, which is funded by the Gates Foundation, the governments of Canada and Ireland, will talk about answering the question, why integrate hand washing in Bangladesh?
Thanks, Hannah. The Alive and Thrive project is focused on improving infant and young child feeding practices, and the main reason why hand washing became a very important and central focus of the program was because we were running up against barriers related to poor appetite in children when they start complementary feeding. Now, it's well known that the incidence of disease rises at about the same time that complementary feeding starts, after a period of 6 months of exclusive breastfeeding. And there was plenty of evidence from ICDDRB in Dhaka, in Bangladesh, showing that samples of complementary foods are highly contaminated and that the transmission route relates to poor hand washing and hygiene practices. So series of studies were done, qualitative and quantitative, to find out what the drivers of a change in this behavior and this practice might be. And the three concerns that came up was, one, a lack of belief in the benefits of hand washing for infant and young child feeding, that it was related in any way to child health or poor appetite. Secondly, it was not part of the social norms, so mothers didn't feel compelled by social pressure to follow this practice. And thirdly, very importantly, convenience. The soap may be found in one part of the house and the water somewhere else. And in feeding children several times a day, it just became very difficult for her to try to remember and then go and find the soap and the water and bring it to where the child was, or bring the child to where the facilities were, etc. So intervention was designed, and through trials of improved practices, qualitative research methodology, we tested this out. And this is just an example of a simple job aid that was created, integrated within the child feeding job aids, which shows very visually the transmission of germs to the child and child getting sick, and then simple ways of creating a hand washing station to improve the convenience factor, bringing a hand washing station close to where the child was fed every day, and a few other do's and don'ts about hand cleanliness and feeding young children. So at the end of the trial, we found that, of course, because it was a trial situation, 100% of mothers who enrolled had tried the practice. 78% reported that they had practiced hand washing, and about 50% were observed to actually wash hands, and this was starting from baseline of about 3 to 5% who had been washing their hands before feeding children every time. So this study was, the primary investigator was Steve Luby and his team at ICDDRB, and a poster from this study will be presented at UNC. So look out for that. And you'll see a comparison of providing hand washing stations versus encouraging families to build their own hand washing station close to where the child is being fed. So we are taking this forward. Government of Bangladesh adopted this, and as we are moving into a dissemination phase of Alive and Thrive, we are hoping to expand the uptake of hand washing as an integral part of complementary feeding throughout the world. Another piece of the integration package that we are hoping to build on is early childhood development. We believe that the total development of the child with nutrition, hand washing, and early childhood development would be a very strong package for strengthening human resources in the same age group, working with the same families through similar delivery systems. So this is kind of where we are looking at for the next phase. And there is an initiative within our group, Clean, Fed, and Nurtured. We are hoping to gather momentum by engaging all of you in that as well. Thank you.
Thank you, Tina. So we've talked about integration, and now we are going to talk about innovation. Innovation is another buzzword within the international development community right now, and the hygiene sector is no exception. Innovation can mean many things, from service delivery to products to behavior change methodologies. In this thematic area, we will hear first about 2 programs that are using mobile technology to educate mothers about health and hygiene. Stephanie Bowen will speak first. She's a senior communications manager for the Mobile Alliance for Maternal Action, also known as MAMA. She's responsible for developing and implementing an overarching communications and PR strategy for MAMA, and she will discuss how they are using mobile technology to share information with mothers. I'm not sure where mine. Oh, great. I don't see mine. Okay. Ah, great. Hello. So, MAMA. We know that the maternal child health challenge that we're trying to address is that every day 800 women die of pregnancy or childbirth-related problems. And every year, 3.1 million newborns die. Most of these are from preventable causes. At the same time, 1 billion women have mobile phones throughout the world. And we're not just talking about big urban areas, we're talking rural areas and throughout the developing world, more and more women have access to mobile phones. So in 2011, MAMA was launched to try and leverage the massive proliferation of mobile phones to help close some of those maternal newborn child health gaps. Our partners, USAID, Johnson & Johnson, Baby Center, and the United Nations Foundation all came together as a public-private partnership to see what we could do. 3 years later, we're reaching 1.6 million women. Our first program was in Bangladesh, where we just tipped 1 million people last month. That was very exciting for us. We also have a program in South Africa, and we're launching in India next month. We had a pilot program that we've started over the summer with about 100 women that is now getting ready to expand. The MAMA messages, how they work is they're highly personalized. They are coordinated with the mother's, the stage in her pregnancy or where her child is in development. And they are delivered 2 to 3 times a week, depending on the program. And they give everything from encouragement, help women recognize warning signs, and remind about vaccinations or other health issues that they need to know about.
one of the things I love, one of my favorite messages that I recently learned about was we give messages about when eyelashes are developing and when the fingernails are starting to come in, how the baby's moving, which I'll get to in a minute. But we've discovered that really customizing those messages, customizing the times when they're delivered, it all really has to be quite intricate for us to be able to develop the relationship with the women that will get them to adopt the behavior change that we want to see. For example, in Bangladesh, we have more than 40 variables that go into choosing the messages. And the platform that we developed with our partner there takes into account all of those platforms, or all of those variables. Whether or not you're pregnant, whether or not you're, how old your child is, perhaps you are illiterate and you can opt to get a voice message instead of a text. You can choose what time of day you want the message delivered and what day of the week. Maybe it will go to the caregiver or the husband or the mother-in-law, or maybe it will go to the woman herself. And by having all of those different options, it really allows for not only giving the education, the health education to the woman, but all the people that are working with her to help her care for herself and her baby. We really integrate the messages into the woman's life, and we create a relationship with the woman. So that allows us to give a broad range of information, like hand washing and hygiene, or HIV. For example, in South Africa, we have developed a whole set of prevention of mother-to-child transmission messages that are much more effective because we have taken the time to build the relationship with the woman and help her get comfortable with mama and her HIV status. As I mentioned, the subscribers really trust and value the service, and they highly recommend them to others. We have seen improved knowledge, attitudes, and behaviors. We're starting to do more in-depth research, but just from our first country program in Bangladesh, from phone surveys we've seen that the recommended health outcomes that we want to see, increased breastfeeding, facility-based births, antenatal care visits, has been dramatically higher than what we're seeing nationwide. And that's it. So look forward to talking to you afterward.
So moving right along, we are going to look at innovation in a new way now. One area that I find particularly ripe for innovation is the so-called hardware side of hand washing. This includes hand washing stations, taps, soap dispensers, and the like. To make hand washing a habit, these materials must first be available. Purna Seth is a graduate student of International Affairs at Columbia University, and she's an innovator in this arena. Originally from India, she has a diverse background, ranging from grassroots development to helping launch the largest independent music festival in the country. She stumbled onto hand washing during work in a rural community and has yet to stop thinking about it. She is interested in how to explore product-based inventions and how they can promote behavior change. In this presentation, she is going to introduce us to her pilot product, which is called the Clean Tap.
Thank you, Hannah. Hi, everybody. I'd like to introduce you to Clean Tap, which is a pilot that I worked on over the summer in India to promote hand washing behavior among street food vendors. But before that, I want to kind of go back a little to January 2010, when I actually helped develop a Tippy Tap, which is a low-cost, low-resource, hands-free hand-washing device that has been used extensively in rural India and Africa to promote hand-washing behavior, especially among children. And at that point in time, I found myself thinking, what would it take to actually adapt this idea to an urban setting? So last semester, I was in a social entrepreneurship class in school, and I had the opportunity to play with that idea and kind of develop it. and I decided to develop a tippy tap for an urban setting, specially focused on street food vendors. There are a few reasons why I chose street food vendors specifically over, say, slum communities or community schools in urban areas. Street food is an integral part of Indian culture, and whether you're a daily wage laborer or a Bollywood superstar, everybody eats street food. So I kind of felt like it has the potential to touch a lot of lives, and it would be very interesting to explore hand washing in a food setting. But there's also general acceptance that, street food's not safe, it's not clean, it's unhygienic, and I kind of wanted to push those boundaries to see how we can actually get people to take action on that front. The government of India has actually been doing a lot of work on that front in terms of increasing hygiene awareness amongst food vendors, but there was a gap in terms of increasing awareness and providing facilities to actually put that awareness into action. And I wanted to bridge that gap. And of course, like all stories go, there's a personal angle to it. I got typhoid eating street food a few years ago, so I have a personal vendetta against dirty hands. So over the summer, I received a small grant from an organization called Deep Prize in the Bay Area, and I decided to do a 12-week pilot in India to develop a prototype of the device. There were a couple of different things that we wanted to achieve with the pilot. One of them was to experiment with design and do design iterations to understand how the mechanics of a hands-free device in an outdoor setting like street food would work in a busy city in India. And we actually felt this would be the relatively easier part to get the design down right. And the second was to gauge response from food vendors and the customers eating at the food vendor's stall, which we felt would be a lot more challenging than the design. So we ran a 12-week pilot. We had 2 phases where we tested hand washing behavior before the introduction of the device and hand washing behavior after the introduction of the device. It was a very, very fast-paced 12 weeks, and there were a lot of learnings and takeaways that we had from this period. I'd kind of like to cover some of the biggest, most essential takeaways that we had. One, we realized that customers are an integral part of the equation, because if I want to encourage a food vendor to adopt a new behavior or adopt a new device, I need to make sure that he understands that it makes business sense for him, that it's something that will drive more customers his way. So we realized that instead of focusing on targeting the vendor directly and messaging, using our messaging to tell the vendors to wash hands, it would be interesting if we actually target the customers and we use the customers as a mechanism to create behavior change in the vendors. So all our messaging that we used during the pilot was all directly targeted towards the customers. And we had a lot of, very good feedback from that, where we actually, without directly reaching out to the vendors, saw vendors using the device to wash their hands, asking the customers to use it. So it was a ripple effect that we were hoping for, and we really got to see that, which was nice. And, that ties into my second point. We realized that vendors and customers were both very receptive to it, unlike what we expected. They looked forward to using the device, and we went through a couple of different design iterations. We went through 4 design iterations during the 12 weeks, actually. And every single time we had a design problem or a mechanism problem, we had to take the device back to the workshop to fix it. We'd have customers ask us regularly about what's wrong, when it's going to come back. So our assumptions got flipped over, where we realized that, people are a lot more receptive to it, but design is actually a lot more challenging to get down right, but extremely important, because without the design being correct, getting the vendors to use it and actually purchase it is going to be very challenging. And the last takeaway that we had that I find very exciting, because I love, secondary outcomes that come out of projects, was the fact that we found that vendors save about 10 to 15 liters of water per day by using the device than if they used other mechanisms of hand washing, which were relatively inefficient and ineffective, which was one of the things we really wanted to see. So that was very nice. And I think that's the gist of CleanTap and what we did over the summer. I plan to continue working on it. I'm actually right now looking for designers to work with, to work off all the takeaways we've had, and develop a prototype that is a lot more robust, that I can actually take to a market and do a full-fledged launch after in the next 1 year. At the same time, I want to experiment with trying to understand that in a food setting, in an outdoor setting where measuring behavior change is a lot more difficult. I want to try and develop more robust mechanisms of observing that behavior change and being able to measure it, for which I'm right now collaborating with a few of my professors in school. And lastly, I'm obviously raising funds so that I can, fund all of this and actually do a launch in the next 1 year. So yeah, that was short and sweet. Thank you.
I sometimes wonder if we need something like that here when I'm eating at food trucks. So innovation is not only isolated to hygiene promotion in the developing world. In fact, the private sector here in the US also has room for greater innovation. CC Pandel is the communications director for Soapbox Soaps. She and her colleague Grace will discuss how the company is working to help people make a global impact through everyday purchases.
Hello, everyone. Like Hannah said, my name is Cece, and I'm the Director of Communications for Soapbox Soaps.
I'm Grace. Hi there.
Grace is my social media intern. If you haven't heard of us before, we are a mission-based personal care company. And decoded, that means that we are the Tom Shoes of soap, and we don't mind that comparison at all. Soapbox was born out of the idea that we can always do aid more effectively and more efficiently. Our co-founders, Dave Simnick and Dan Dahl, believe that with aid, money is power, and if you put that power into the hands of people who want to do good, they will feel more free to innovate and worry less about things like R&D costs. And consequently, you'll find better ways to improve lives all over the world. And that's why Soapbox gives out of the profits of its sales directly.
Like the Tom Soaps model, we are a buy one, give one product. So for every bar of soap you buy, you get a bar of soap. When you purchase our liquid hand soaps, we give a month's worth of clean water. And for our body washes that are purchased, we give a year's worth of multivitamins. We partner with organizations that do phenomenal work already, like Raincatcher for our clean water projects, as well as Vitamin Angels that helps us distribute our multivitamins around the world.
So our bar soaps give a little bit differently. For every bar soap that we sell, we give a bar away, but we do it in a few different ways. So one way is we work with a partnership with Global Soap Project, and this organization collects used hotel soap bar remnants, sanitizes them, and reforms them into new bars. We give these bars as our one-for-one, and 70% of these bar donations are done in the U.S. With homeless shelters and food banks.
The rest of the 30% is done internationally. So when we look at organizations abroad, we try to work with local nonprofits to bring in soap, but without ruining that local economy. So we work with organizations to help teach them how to make the soap and then distribute the soap, and work with hand washing either techniques or projects that they already have at hand.
So all in all, we're here to help. We're launching in some really big chains this coming year, and that means that we get to give more. So we will be able to give some serious soap in the coming year to things like emergency relief, all kinds of hygiene aid, both domestically and abroad. So come find us afterwards if you have an opportunity for us to give to you, and join in our conversation at Soapbox Soaps.
Thank you.
Thank you.
Thanks, ladies. And they have a table over on that side of the room, so be sure to stop by and smell their product. It smells fabulous. So last but certainly not least, behavior change. Innovation and integration are all well and good, but unless they lead to lasting habit formation, people, households, and communities will not be able to realize the full benefits of hand washing with soap. For this final segment, we're going to turn to the Super Ama campaign to learn how they used emotional messaging to spur behavior change. This short video will show you an overview of the campaign and their findings. So, hand washing, integration, innovation, and behavior change. Now to the Secretariat Director of the Global Public-Private Partnership, Layla McKay, who has the task of giving us a brief summary of the things we've discussed.
Thank you very much, Hannah. Ladies and gentlemen, what a fascinating and diverse range of presentations we've had here today. Let's give a round of applause for all of our speakers. What's exciting is that what we've heard today represents just a small sample of all the really fascinating, amazing work that's going on right now around the world. But we know that it's not enough. We know that still millions of children are dying every year because of diseases that can be prevented by good hand washing. We know that good hand washing can help to really stop global threats like Ebola in their tracks. And we know from several of these presentations that you don't have to work directly in hand washing in order to have an impact. You can get more information about hand washing at globalhandwashing.org, and from research and educational materials and various things for Global Hand Washing Day, including a planner's guide to do events. But after this presentation, as you move towards the back of the room for food and drink, please turn to the people who've been speaking here today and ask them your burning questions. But also turn to at least 2 people you haven't met before and just have a quick chat about what you do in hand washing and what you can do in hand washing. No matter what sector or setting you're in, don't just ask what hand washing can do for you, but ask what you can do for hand washing. This has been a really inspiring hour. Thanks again to our co-sponsors, FHI 360, Devex, and Wash Advocates, and of course the 10 organisations that comprise the steering committee of the Global Public-Private Partnership for Hand Washing. Thanks also to all of you for taking time out of your day to be inspired by integration and by innovation and behaviour change for hand washing. Let's end this session right by hearing from Nigeria, from someone who's using role modelling, social norms, education, and a catchy tune to promote hand washing, just released for Global Hand Washing Day this year. Take it away, Sunny.
Wash your hands, wash your hands. Like a this, you go wash your hands. Like a that, wash your hands. Wash your hands before you cook. Wash your hands before you eat. Wash your hands before you serve food. Wash your hands. If you go toilet or change picking diaper, wash your hands. If you touch sick person or touch animal, wash your hands. Dirty hands, they carry disease, where they make plenty people see. Everyday children, they die from habits where we need to stop. Prevention is cheaper than cure. Hospital now plenty money. Wash your hands with soap and water. Wash your hands, prevent Ebola, prevent diarrhea. Wash your hands. Prevent cholera, prevent pneumonia. Wash your hands. Prevent typhoid and other infections. Wash your hands. So tell your son and tell your daughter. Wash your hands. And say tell your father and tell your mother. Wash your hands. Hand washing saves lives.
That are being launched this very week for Global Hand Washing Day. So ladies and gentlemen, go forth, chat, plan, enjoy your food and drink, and happy Global Hand Washing Day 2014.